And welcome back to the Citi Newsroom. My name is Vivian Kailoko. Let's do some health stories. The Renal Patients Association has expressed astonishment at the statement made by the Chief Executive Officer of the Korle Bu Teaching Hospital, denying that 19 patients died between May and September last year when the renal unit was closed to outpatients due to a shortage of consumables. According to the association, their data from the unit contradicts the CEO's denial. This report has more.
Chaos erupted when the renal unit at Korle Bu Teaching Hospital ceased outpatient services from May to September 2023, attributing the disruption to a critical shortage of essential medical supplies. During this period, the unit operated solely for emergency cases, significantly impacting patient care. Amidst the uncertainties for these patients, the Renal Patients Association claimed that 19 out of their members who had sought services at the unit prior to its closure had tragically lost their lives. However, the hospital's chief executive has refuted these allegations, stating that no recorded deaths were documented during the closure period.
Because of the credit situation, we were having some challenges with the supplier, and so we're not getting supplies became a challenge. So we thought that, look, instead of getting to the point where we run out completely and shut down the service altogether, why don't we ration what we have whilst we try to sort out the issues with the supplier? So we felt that, look, let us cater for the inpatients and emergencies. And then the patients who are ambulant, they should try and get service elsewhere whilst we quickly try and sort out this problem. So that's what we're doing. And then everybody comes and says, Korle Bu renal dialysis unit shut down. And then we're told that there were about 19 people who lost their lives. And then I'm still waiting for the names of those 19 patients, because during the period where the outpatient was shut, we still had the emergency open. And every patient of ours, once you have any emergency, you come in and we treat you. So we do not have any record of any of our patients who needed emergency care that was denied that care. Yes, so this falsehood is being bandied about that so many patients lost their lives because Korle Bu dialysis unit was shut, And so this also creates a certain negative narrative.
In response, Kojo Ahenkra, the spokesperson for the Renal Patients Association, expressed surprise while countering the CEO's denial in an interview with Citi News. For the association, its data from the renal unit contradicts the CEO's stance.
The unit was close to the outpatient, but they were doing emergencies and the ward cases. They were doing those ones. But the outpatient, with the outpatient, the unit was close to us. That was it. Per my data, I think we lost 19 people. So I'm so surprised that now that they are trying to refuse that the number that we put across, they are now refusing it. I'm so surprised. I don't know the reason why this thing is coming up. We are taking information that it will be increased again. As at when and where, with that one, we don't even know. We are getting information that it will be increased. They are trying to push Parliament to approve. But the point is, even the 380, still, we can't speak. Even the 380 is a challenge for a lot of people. The 380 is a challenge for a lot of people. But that is the lowest you can get in town now. Korle Bu, that is the lowest you can get in town now. Sometimes Korle Bu is also being realistic, because the consumables are very expensive now. I let even one dialyzer, the artificial kidney, is 30 euros, 30 or 32 euros. Now, so converted to Citi. Our Citi2 is not stable. So Korle Bu will definitely run a deficit. So you people need to also to give us those avenues for us to talk. So that is the challenge we have now. If they run the right and they increase it again, all of us are going to die. They can't pay.
In a related development, the hospital is also urgently appealing to Parliament to expedite approval of their new prices for dialysis services to help recover its debt and manage the unit effectively.
We want to encourage our legislature to pass our fees and charges proposal so that at least we can recover costs, for what we are. Because every session of dialysis that we are offering now, we are under recovering. And for Korle Bu, it hits us harder because we undertake around 2,000 sessions of dialysis every month. So we have the highest volume. You see, so other places, because they have smaller volumes, they can cross-subsidize. But for us, it's a very significant amounts if we are still accumulating that kind of deficit. And so those are some of the challenges on the ground. I know that some people may have a question or two to ask, but that is the situation. And so let us all work together, to support each other. So from prevention, by screening, through to the treatment support for people on who need chronic dialysis, and then to providing transplantation as another option that wins people off dialysis. I think those, if we look at those, I think it will be a big improvement in the care for renal patients.